Makikita mo yung pinang... Sige, call mo ako.
Throughout the leg assessment, note the leg's active range of motion,
Magbubugin mo yung angle mo.
and strength. To assess the vascular system,
Ano ba kasi ang pangit?
observe their skin color and condition, hair distribution, and
Video yan para malaman mo kung ano yung ano, speaking
look
of
for
mga
abnormalities, such as asymmetry, venous patterns, lesions, and edema. Then, using the back of your hand, check the temperature of the leg from the feet up. It should be warm and symmetrical. Now, flex the patient's knee and compress the calf muscle against the tibia. Release the pressure, and then dorsiflex the patient's foot. Neither action should cause pain. Next, palpate the peripheral pulses in the leg. To palpate the femoral pulse, find the artery halfway between the symphysis pubis and the anterior superior iliac spine. Compress it and release slowly. The pulse should gently tap against your fingertips. To locate the popliteal pulse, bend the patient's knee and feel for the pulse in the popliteal fossa. Next, palpate the posterior tibialis pulse in the groove between the medial malleolus and the iliac tendon. Assess the dorsalis pedis pulse by palpating lightly, lateral to the extensor tendon of the great toe. Check for edema by pressing over the tibia or medial malleolus for 5 seconds and then releasing the pressure. Normally, finger pressure does not leave an indentation or pit. If it does, grade the pitting on a scale from +1 for mild pitting to +4 for severe pitting. Continue to assess the leg by
Kaya mas
evaluating
pag
their
namin
sensory
daily
function.
nagte-telepono.
As you did when you tested the sensory function of the arm. Assess the patient's leg for light touch sensation, pain sensation, temperature sensation, vibration sensation, and position sensation.
Galing ng leader namin, no?
Next,
Nagte-telepono.
test the patient's motor function by assessing his deep tendon reflexes. First, test the quadriceps reflex. Have the patient sit up with his legs relaxed and dangling over the edge of the exam table. Place one hand above the knee. Then tap his patellar tendon with the reflex hammer. The lower leg should extend and the quadriceps should contract. Next, test the Achilles reflex. Have the patient bend his knee, rotate his hip outward, and dorsiflex his foot slightly. Then tap the Achilles tendon with the reflex hammer. The normal response is plantar flexion. Finally, test the plantar or the Vinsky reflex. To do this, stroke the lateral aspect of the sole of the foot from the heel upwards. The normal response is plantar flexion with no toe fanning or great toe dorsiflexion. If any of the patient's reflexes are hyperactive, check for clonus, an abnormal pattern of rapidly alternating involuntary muscle
Yung
contraction.
leader talaga namin, hindi gusto. Bahay.
Lightly support the lower leg in one hand and dorsiflex the foot
Hindi
with the
talaga siya
other hand.
nag-ano.
Normally, you should not see extra movement or
Sexy!
contractions in the leg.
Sexy!
During the next part of the assessment, you'll evaluate cerebellar function. For the heel-to-shin test, ask the patient to place one heel on the opposite knee and slide it down to the ankle. You should be able to do this in a straight line on the shin.
Video
To assess the patient's gait and gross motor function, instruct him to walk 10 to 15 feet, turn, and then walk back toward you. His movements should be smooth and coordinated. His arms should swing freely, and he should turn without losing his balance. Now perform the Romberg test. Have the patient stand with his feet together, his arms at his sides, and his eyes closed. Standing close to him, observe him for 20 seconds. He may sway slightly, but should not lose his balance.
Bye-bye.
This simple test assesses the acoustic nerve.